Dear audience, let me present my PhD topic, which is investigating the relationship between periodontal conditions and systemic diseases. I am Kitti Hohl, a first-year PhD student. My supervisors are Ákos Zsemberi and Zsuzsanna Helyes, and our senior advisors in the topic are Réka Fazekas and Fruzsina Kis. My scientific methodology expert is Alexander Schulze-Wenning, and my SMS is Lőrinc Frivalszky. My vision is to reduce the incidence of systemic diseases through appropriate treatment of periodontitis, and to achieve that, I would like to determine the causal relationship between periodontitis and systemic diseases and their therapeutic outcome. In order to achieve my mission, I have two ongoing projects. One of them is a systematic review and meta-analysis, and the other one is a registry analysis project. The title of my first project is Investigating the Prevalence of Liver and Pancreatic Diseases in Patients with Periodontitis, using the methodology Systematic Review and Meta-Analysis. Periodontal disease is a set of inflammatory conditions affecting the tissue surrounding the teeth. Periodontitis is the 7th most prevalent disease worldwide with 1 billion cases. And there is a wide range of oral bacteria with more than 750 species, which can reach other organs through ingestion, bloodstream, and immune cell migration, causing extraoral consequences. So the liver and pancreas might be damaged. It can affect the liver, causing chronic liver diseases, including non-alcoholic fatty liver disease, cirrhosis, and hepatocellular carcinoma. There is a higher risk of non-alcoholic fatty liver disease among patients with periodontitis, and it has been recently shown that oral pathogens can contribute to the progression and development of non-alcoholic fatty liver disease. Oral pathogens can also affect the pancreas, so presence of Porphyromonas gingivalis and Aggregatibacter actinomycetam comitans can increase the cancer risk by 50%, suggesting that oral bacteria precedes the development of cancer. So our aim is to demonstrate the higher incidence of liver and pancreas diseases among patients with periodontitis. And what we want to know, does periodontitis increase the risk of liver and pancreatic system diseases? We are using the population of a general population exposed to periodontitis compared to absence of periodontitis. And their outcome would be prevalence of liver and pancreatic diseases. And their hypothesis is periodontitis, an inflammatory disease triggered by bacteria, can contribute to the development and progression of liver and pancreatic diseases. And their clinical implication would be periodontitis management might decrease the incidence of liver and pancreatic system disorders. We conducted our systematic search in 3 databases with the following search key. I designed 2 domains. The first domain is related to the the periodontal condition, and the second one is related to the diseases we would like to investigate. After the duplicate removal, 10,000 articles has remained, and we have found 83 articles based on the title and abstract selection. And after full text selection, we have found 22 eligible articles. And through citation chasing, I have found 4 studies based on full text. So altogether, we have 26 eligible studies. Right now, I finished the data extraction and started the risk of bias assessment. My second project is investigating the risk factors of medication-related osteonecrosis of the jaw using the methodology registry analysis project. Medication-related osteonecrosis of the jaw affects 1 to 10% of people. It is a potentially preventable side effect of using drugs like bisphosphonates, denosumab, and anti-angiogenic drugs. Patients receive these medications for diseases like bone metastasis, primary bone cancer, osteoporosis, and myeloma multiplex. It is a really severe condition, impaired with masticatory malfunction, problems with speech, swallowing, and it affects the quality of life. Because of the severity of this condition and the limited treatment options, 20% of patients remain with persistent symptoms. And to prevent that, we have to extract the non-restorable teeth and optimize the oral health, and we have to educate patients about the potential risks. There are some known systemic risk factors, for example, malignant tumors, comorbidities, age and gender, and tobacco and smoking. And there are some drug-related risk factors like IV administration, high cumulative dose combination therapy, and longer duration of treatment. And some of the local risk factors are poor oral hygiene and pre-existing inflammatory dental disease. So our aim is to assess and compare the importance and co-occurrence of risk factors of medication-related osteonecrosis of the jaw. So what we want to know is, how does local risk factors influence the timing and severity of the clinical presentation of MRONY? Our population would be patients with different individual risks of MRONY. We would like to compare the unsolved local risk factors with no local risk factors. And their outcome would be clinical features of the osteonecrosis of the jaw, including severity and staging at enrollment. And their hypothesis would be certain local risk factors increase severity and stage of the condition. Our clinical implication is, would be selecting high MRONY risk patients and determining prevention options. As a summary, we would like to submit the first project until September 2025 and the second project until February 2027. I would like to finish with a quote of Albert Szent-Györgyi. Research is seeing what everybody else has seen and thinking what nobody else has thought. Thank you for your kind attention.
Thank you very much. It was very, very interesting. Yeah. Does anybody have a question? I think my committee member has.
Thank you very much. I have a question according to your first topic. So you mentioned that Fusobacterium nucleatum and Porphyromonas gingivalis are common in these liver diseases. Do you know maybe other systemic conditions or diseases where it is known that these bacteria are playing a role in the etiology? Thank you.
Thank you. So it has been already shown that periodontitis influences some diseases. For example, based on literature, cardiac diseases, respiratory, renal diseases, rheumatoid arthritis, and diabetes. And even periodontitis can form a bidirectional relationship with diabetes. If I could answer your question.
Thank you, Kitti.
Thank you.
Does anybody have a question? Yes, Professor?
Thank you very much for this very interesting presentation. My question would be to your first topic, that we know that systemic diseases are accompanied by worsened periodontal problems. How can you differentiate if periodontitis causes the problem or the systemic disease was the first and secondarily periodontal disease developed?
Thank you for your question. Yes. Based on the literature, there are some risk factors other than periodontal disease causing non-alcoholic fatty liver disease and these other diseases. For example, some of the articles excluded patients based on the excessive alcohol consumption, which is more than 20 grams per day. And besides that, they excluded patients with diabetes and some hepatic steatosis promoting medications like methotrexate and immunosuppressants. And they excluded also patients with already existing liver diseases.